Dr. Darshan Rangai is a fellowship orthopedic surgeon with experience in super special procedures of hip and knee joint, including complex joint replacement, arthroscopic ligament reconstruction, and joint preservation. He performs a range of procedures with patient-centered care using precision technologies like robotic-assisted computer navigation and finite element implant stimulation. Here, he has worked in several centers of orthopedic excellence across the globe during fellowship, including Sydney, Vienna, and Stockholm. His research interests include implant biomechanics, hip and knee surgery, and has authored several peer-reviewed publications and book chapters in these areas, among others. On the first, I call upon Shrutina, physiotherapist, Whitefield Center, to render the invocation.
सरस्वती नमस्तुभ्यं वरदे कामरूपिणी विद्यारम्भं करिष्यामि सिद्धिर्भवतु मे सदा पद्मपत्रविशालाक्षी पद्मकेसरवर्णनी नित्यं पद्मालया देवी श्यामं पातु सरस्वती भगवती श्यामं पातु सरस्वती. Welcome to each and every one of you for being here with us today. Sukino is a healthcare organization, is a comprehensive continuum healthcare service provider of care for chronically ill patients needing out of hospital care. Our mantra is Sarve Jana Sukino Bhavantu. Feel better every day. Providing recuperative, rehabilitative and palliative continuum care facility. Treatment include care of cardiology, oncology, nephrology, neurology and orthopedic condition with our doctors team, nursing team, caretakers, physiotherapists, nutritionists with personalized treatment plan. Today our Sukino had organized this special program, DocToc. Anyone at any phase need rehabilitation at some point of our life. So, especially ortho-related, to optimize function, reduce disability and prevent complications. A very special welcome to our chief guest, Dr. Darshan sir, orthopedic surgeon with the experience of super specialty procedure of the hip and knee joint, including complex joint replacement, orthoscopic ligament reconstruction, and robotic assisted orthosurgery. Thank you so much, sir, accepting our invitation and addressing our audience. Welcome to Saravanan sir, head of the Sukino sales team. Welcome to apartment community members. Welcome to Sukino therapists from all our centers. Welcome to all my Sukino family members. Welcome to all of you for this special program. Thank you.
May I request Dr. Darshan to address the community about the importance of rehabilitation?
Very good afternoon, everyone, and I thank you all for being here, especially on a weekend. Okay, if you all are here, then it just says that you understand the concept of rehabilitation. And what I'm going to do is we'll keep this session as very interactive. I want you to feel free to ask me any questions that springs to your mind, and I'll try and highlight some of the very basic points as to why rehabilitation is so important, more so in the current situation that we are in. So, whenever we talk about orthopedic rehabilitation, there's a lot of questions that will spring to your mind. You know, what's rehabilitation? What does it involve? Who does it? Where is it done? You know, these kind of common questions always spring to the mind. And we try and ask the answers. Now there's different sources of information which is widely available these days, and people generally try and get some information and make up their own opinion about it. Next slide, please. Whereas some would say, you know, I just do my routine exercises, why should I bother? And obviously anything associated with healthcare in the current environment has cost implications. So people will have questions about how much does rehabilitation cost, what does it involve and all that. But I'm not here to talk about any of those, okay? Because according to me, none of this matters. What really matters is this one, which is what we call as clinical outcomes. Okay, anybody interested in the story? Yeah, raise your hands if you're interested to listen to a story. Okay, thank you. Fine. So, this one, please. So this is one of the very few first cases that I actually treated in India, and he happens to be a graphic designer, which is a highly skilled job. He's at a very productive age in his life. You know, he's in his mid-30s. And he's right-handed. And next slide. And these were his X-rays. So I'll just give you a little bit of, you know, ABC of orthopedics. This is one of the commonest injuries that you see, but a very kind of debilitating injury, and especially of this age. So you can see that he's got a fracture in his wrist joint, which is dislocated, and it involves both the bones of his wrist joint. Essentially, that means it's a bad injury. Okay. So that was what, you know, a technical kind of assessment or a post-op note in your medical assessment would say that he's got a fracture of the distal radius. But there is a story associated with this patient. This injury happened as he was coming down the steps on the day of his marriage, right from his marriage test. Okay, so that was the first one. The second thing, he had accepted a new job offer and he was only 1 week into that job. And he had signed up to do a contract, and if he wouldn't satisfy that contract, he would end up losing the job. So it had social implications, and there was a lot of work pressure to it. So you can imagine, although this looks like a pretty common injury that anybody and everybody you can talk about, you know, somebody having a fall, they have a wrist fracture. So what do you do about it? And that's where I think this point comes to home. Okay, it's about how does rehabilitation improve the clinical outcomes. So he went and he asked a local doctor in terms of what could be done, and they told him, well, we have to strap you up in a plaster. You have to be in a plaster for 3 months, which essentially meant that he would lose his job. Because as a graphic designer, most of the IT people will tell you, if you can't use the mouse, if you can't type, then you are essentially defunct. Okay? And apart from this, the other thing is the loss of limb function. That means that was his dominant arm. Anything he has to do, he has to use his arm. And if he's in a plaster, he can't do that. And that again brings to the point of clinical outcomes and how rehabilitation is important for that. So I got a call probably about 8 in the evening he happened to contact one of his family friends, and I had treated his mother. So she said, why don't you call this doc? He's come back from Cambridge and this and that and all that. So I called this guy up and he said, I'm desperate to help me. So we saw him and I told him whatever was mentioned in the previous slide is all kind of 19th century treatment. You don't go into a plaster for 3 months. It's not required. So there are other options, and that's where education comes in, and that's where I think Sukino has done a good job of it, and I would like to compliment the entire Sukino team. Unless you have outreach efforts like this to spread the message in the community that other alternate treatments are there, people kind of blindly follow one track. So what happened was we operated on him. It's a fairly standard operation. I haven't done any master surgery by this. It's not pioneering surgery, okay? If you ask 10 orthopedic surgeons on the road, probably 9 would be able to do a better job than me. So I did a very average job. I haven't done any fantastic work. But what is important is this challenge in terms of how do you return him back to that limb function. We take most of limb function for granted. It's like me holding this or picking this up, taking your key, holding your phone. All of this counts as limb function, right? And we take it for granted. It's only when you have very debilitating injuries like this that you start to appreciate what Mother Nature is giving you. So that is where most of the focus was. So we had to create a customized rehab plan because that guy told me very clearly, Doc, I'm going to give my hand to you, but make me fit to go back to work in 3 weeks' time. That is what he had bargained with his boss, to say, I'll be able to use the mouse in 3 weeks. Okay, and this was kind of a challenge to me as well. So we looked at what we do in terms of getting him to have an accelerated rehab. What are the kind of activities that he can safely do without, hampering the surgical outcome? And we had to look about certain physical, which is what you see here in terms of this fantastic equipment, but also certain virtual reality-based activities, which is what this thing is here. And the whole idea was that we had to get him back to work within that short time span. So all of this happened, and we got him to do certain things. And probably about 3 months after I had operated on him, I had to give a talk for one of the trauma conferences, which was organized by AO. And I asked my coordinator to get in touch with him, just to see how he was doing. Because he came for the first follow-up and he was extremely happy, and we kind of said our goodbyes. Typically these injuries take a lot longer, but because he went through an accelerated rehab, he was able to hit all those milestones much earlier. It's the same like, let's say, if you have to travel from here to Delhi, right? You can travel by road, you can travel by a car and train and a plane. You travel the same distance, but you achieve that much faster. And that's what accelerated rehab does. Can you play the video, please? So this is the response I got from him. Is there music? Play music. So it kind of tells a story what this person has been through. So these are all, the injuries and the scars from his surgery. This he tells me happened about a month after the injury. Very happy with all the things that he had achieved. But I think what he told me was his most happy about this. He got this on a new loan, okay? And the fact that he was able to ride his bullet back again was what made him very happy. And this is what I was talking earlier about in terms of clinical outcomes. And this wouldn't have been possible without the rehabilitation. Okay? And I can't emphasize more in terms of the importance of rehabilitation. This is what you see in the community. It can make a whole deal of difference to anybody's life if you go through the structured rehab at the right point of time. So if you ask me, rehabilitation is a very important component of anything I do as an orthopedic surgeon. So that's why we never work in isolation, we always work as a part of team. Okay? And the physiotherapists and the rehab specialists that you see around you today make all that difference to the outcome. So anybody who has arthritis, anybody who has any kind of painful joint condition, whether you have surgery, you don't have surgery, you have joint preservation injections, you have an osteotomy, all these kind of things only achieve the desired target if you have rehabilitation combined with it. So just to put, like if there is one takeaway message that I can give you today, right? Anything to involve with orthopedics is because of two things going wrong. It's mechanics and biology. Okay? So the two feed into each other. So I'll give you an example. If you have a fracture, break a bone, you affect the mechanics of the joint. So that will affect the wear rate of the cartilage. So it creates a biological problem. So let's say if you have rheumatoid arthritis, it's predominantly a biological problem. But your joint wears out much faster and then you get deformity. So always mechanics and biology go together and they act to add to each other's problems. As doctors, we can combine the two treatments, but the important component of that, to correct the mechanics, is rehabilitation. Okay? So anything to do with any injuries in the body, okay? I think rehabilitation forms a very crucial part of that. If you had any form of surgery, I always tell most of the patients, you'll be seeing me probably for a day or two, but you'll be seeing the therapist for months together. Is that right? Next. But in essence to this, it's also important to notice that it plays a critical role in reducing the pain of the patients. Because there are many adjuncts, and I don't want to bore you with the details, and I think Dr. Karthik here is a better person to explain those things to you. There are a lot of adjuncts that they do, not just taking painkillers, okay, which will help to reduce the pain, reduce that swelling, that inflammation after any injury or any surgery, which will help you regain that function much more faster. And overall, it just speeds up the healing process. But in addition to this, you'll pick up a lot of tips and tricks how to avoid those injuries. You know, most of these, the place where I work in the UK, it's called Suffolk. Okay, it happens to be on the East Coast. And if you look at most of the demographics of Europe, it's got the highest average age for a person. So my typical patients, when I worked in Suffolk, used to be about 80 and 85 plus. I very rarely saw youngsters. So if I saw a youngster in my clinic, I'd be very happy. But that's the kind of population. But these population, as you know, are very prone to falls. Simple things. The phone rings, you try to get up early and go, have a fall. Okay? So all these kind of things is where rehabilitation makes a lot of difference, because once you go through the rehab, you talk to the therapist, you understand what the mechanics of those injuries are, then you're able to prevent those injuries yourself. And the final aspect of it is that it basically improves the quality of life. Okay? And this goes back to my main point, that rehabilitation is not about the location, it's not about the equipment, it's not about the cost. All these things come as a part of any treatment that you have. It's what it delivers in the end, which is the quality of life. And I think that to me is the importance of rehabilitation. Okay? So I thank Sukhina's team for giving me this one. Okay? So any questions? Please feel free. recognize with Parkinson's disease is that it is a long-term condition. Okay, so it's the main difference in terms of giving a cricket analogy, whether you're playing a 2020 match or you're playing the test match. Okay, your strategies differ altogether. So a lot of focus with Parkinson's comes at maintaining function. Okay, preventing that disease from affecting your neuromuscular system. A lot of Parkinson's patients face difficulties because their joint mobility starts getting affected. When your joint mobility gets affected, your balance gets affected. That means you're secondarily getting risk of falls. So some of the focus has to be on falls prevention. Okay? And the other aspect which is not very much talked about with Parkinson's patients is they are able to experience all the emotions. But if you see a typical Parkinson's patients, they have this kind of mask-like faces. So they are not able to express themselves. So sometimes in the communication itself, within the families, right, people don't appreciate the emotions that the person is going through. So they go into depression. And that again has an effect on their mental state, how they mobilize, how they perceive life around them. So for me, again, it goes back to that combination of mechanics and biology, right? So any strategy, what you do for Parkinson's, has to focus on keeping that person mobile and functional. That means independent of their ADLs, that is activities of daily living, which is basically, getting up, being able to wash yourself, being able to dress yourself, feed yourself. If you're not able to do that, then that means you reduce yourself in terms of that ability and you need help. Okay? So treatment strategies can be obviously medical, but along with that, rehabilitation and physical therapy is a very important part, because any medications that we tend to give for Parkinson's is aimed at long term, is to minimize the disease progression, is to keep the disease under balance or under check. But the other aspect is in terms of rehabilitation, keeping the joints mobile, preventing contractures, helping people to balance themselves when they're walking around in familiar surroundings. Okay, so these will be the kind of key focuses for neuromuscular conditions like Parkinson's. I hope I've answered your queries.
What I'm saying, if someone had a Parkinson's, how do you either reduce it or keep it at that same level? Yeah.
So again, Parkinson's, because it's a neuromuscular conditions, most of the management would focus on certain medications. Obviously, you go through the complete evaluation of it to establish the diagnosis that somebody has got Parkinson's. But beyond that, what you need to be is on regular medications. Now, those regular medications come in different varieties, they have different purposes, but the end goal is the same. So either keep the disease under control and stop it from progressing. And once you achieve that, the rest of it kind of is built around that. I hope I've answered the question. So it's mainly medical management, tablets, those kind of things is what the focus would be. If there are secondary physical problems, as in contractures, balance problems, or those other things, or if they have injuries, that's where I come in as an orthopedic surgeon, because I'm Mr. Fixer, so I go and fix things. If it's broken, I fix it. Okay, so those kind of things.
You mentioned the objective is to arrest the progress of the disease. Does it mean that it cannot be reversed? It can't improve the person?
In vast majority of the cases, it probably is not possible to entirely reverse it. Maybe it can be balanced to a certain extent, because again, it's to do with the chemical processes that are happening in the neuromuscular system. And if at all the medications are there, they are meant to keep things under control and stop it from progressing. Entire reversal of Parkinson's, as far as my knowledge goes in the published evidence, I don't think there has been much studies to prove that one tablet or one pill given over an X amount of time can completely reverse Parkinson's.
Okay, doctor, I haven't want to know an advice from you that whether for lumbar spondylosis is a remedy of lumbar spondylosis.
So again, lumbar spondylosis is a combination of the mechanics of the spine and what you experience is pain. Most patients with back issues. So I typically see two cohorts of patients. The first cohort is all the younger lot, okay, and especially post-COVID, people who have been working from home. Their entire lifestyle revolves around the laptop, okay, and partly this includes me also. I'm also equally guilty of this. What it does is it affects how your muscles, your proprioception, and everything else rotating around your spine works on a daily basis. So that function becomes more and more and more reduced. The second is what we call as degenerative conditions, which happens as a result of wear and tear. But the end outcome of all of this is what the patients perceive, which is pain. Now the pain can be localized to the back, or sometimes if it involves intervertebral disc prolapse or protrusion, then it sets off what we call as radicular pain. That means pain starting in your back, going down to the hip, your thigh, your leg, your foot, all those kind of conditions. Again, managing this depends on what the underlying problem is. And there are certain other factors which feed into this. Now, spine is a combination of soft tissue and bone. So if you treat only one in isolation, it's not going to work. So you have to look at the bone health, you have to look at the soft tissue health. And if at all there is anything what we call as reversible causes. Vitamin D deficiency is what you've seen, written about a lot, talked about a lot in the media. And that's again something which can be easily corrected, including certain lifestyle choices. Exposing yourself to natural sunlight is a good form to get your bone homeostasis in the right order. And if you're given the right advice, then most of lumbar spondylosis management would in the initial stages be non-operative, which basically means that you go through a certain medications, try and relieve the pain. If at all there's an associated muscle spasm, we get a combination of muscle relaxants. And if there is anything which suspects like a nerve compression on the MRI scan, then you may need a bit more detailed evaluation. But by and large, if you're experiencing a mechanical pain, then it's a combination of those altered mechanics along with certain muscle spasms. So if you can correct this with again pain management and physical therapy and rehabilitation focusing on your core muscles, then vast majority of them are able to function on a daily basis. But the long-term thing is to understand the underlying factors which caused it in the first place and preventing it. Because these things can keep coming back if you're not taking the right care.
After the MRI performed on the MS spine, it has been detected that it is a moderate lumbar spondylosis. So whether we should go for regular physiotherapy or on an interval basis?
See, the simple answer to that is you have food every day. Okay? So the same thing happens to your muscle as well. Okay? So if you find that the underlying cause of that was structural weakness of your core muscles, then they have to be put in order every day. How frequently you do it, to what intensity you are able to do it, which regimen or which protocol you do, which equipment you use, is entirely based on the patient's condition. But vast majority of them would be better off to have some sessions, educate themselves in terms of the right technique of doing it as well. Because there's so much of abundance of information now. Now most of it is credible, some of it is not credible, but there is no barrier out there, no filter out there which will tell you what's credible, good information and what isn't, what is not a valid information. So my advice would be to contact an expert or a specialist or a professional, go through some sessions, educate yourself, and after that, it's your responsibility to do it on a regular basis.
Thank you.
Yes, ma'am. You can ask me something.
मुझे ये टांग के लिए पूछना था, जैसे
जी।
केवल हम टांग ऐसे करके ऐसे क्लीन करते हैं,
जी।
उसके बाद जैसे नीचे रखते हैं वो एकदम स्टिफ हो जाती है, तो काफ़ी देर बाद जाके ये हम उसको थोड़ा ठीक कर सकते हैं, काफ़ी ज़्यादा पेन होने लग जाती है, 5 मिनट या 3 मिनट के बाद उससे नॉर्मल आती है, तो पूरी स्टिफ रहती है टांग में।
देखिए, स्टिफनेस का जो प्रॉब्लम आप बता रही हैं,
जैसे
जी
उस साइड से ले कितनी एरिया होगा?
जी जी, उसके लिए भी कई कारण हैं, लेकिन सबसे ज़्यादा जो होता है उस एरिया में घुटनों का दर्द या पैर का दर्द जो आप बता रही हैं, घुटनों में आर्थराइटिस की वजह से होता है। और आर्थराइटिस का भी बहुत वैराइटीज होते हैं, लेकिन सबसे जो कॉमन है या सामान्य है वो कार्टिलेज की प्रॉब्लम की वजह से होता है। यानी कार्टिलेज का जो क्वालिटी होता है और उसका जो थिकनेस होता है वो दोनों कम होने लग जाते हैं, और उसके वजह से कभी कभी ऐसा हो सकता है क्योंकि उसका इफेक्ट जो होता है आपके मांसपेशियां यानी मसल पे भी होता है, तो उसके वजह से मसल वीकनेस भी आता है, और ऐसे दर्द जहाँ घुटनों में स्टार्ट होता है आपके पैर तक भी पहुँच सकता है। तो मेरा एडवाइस तो आपको यही रहेगा कि अगर ये बहुत दिन से चल रहा है और आज तक आपने इसका कोई प्रोफेशनल ओपिनियन नहीं लिया है, तो इसका प्रोफेशनल ओपिनियन लेना बहुत इम्पोर्टेंट है।
क्योंकि हमारा एक नी का तो ऑपरेशन हुआ है, और सेकंड नी में मतलब वैसे चलने में, घर में नॉर्मल चलने में कोई प्रॉब्लम नहीं है, लेकिन अगर हम थोड़ा ज़्यादा चलना पड़ता है, सीढ़ी चढ़ना पड़ता है या खड़े होना पड़ता है, वो है इसमें प्रॉब्लम। अदरवाइज वो वैसे नहीं है, तो इसी में ज़्यादा प्रॉब्लम आ रही है।
जी जी, और अभी आप साइंटिफिक लिटरेचर को देखेंगे तो एक घुटने का अगर आपको ऑपरेशन हुआ है और एक घुटने में अगर आपका आर्थराइटिस है, तो आपका बहुत बड़ा चांस है कि दूसरे घुटने में भी वैसा ही कंडीशन चलता रहेगा। तो एक का अगर आपके पास ट्रीटमेंट हुआ है, सर्जरी हुआ है, तो दूसरा का आपको ओपिनियन लेना बहुत इम्पोर्टेंट है। Right, sir. Can I know your name, sir? Anuj Kapoor. Okay, so this is Anuj's scan that I'm looking at. Okay, it says translated from German to English. Excellent. So is he in Germany now or in? Okay, so it's a very common injury in the skiing people. Skiing and ACL injury are very closely linked. Okay, to put it in simple context, it's like partners in crime. If you go skiing, and for a combination of reasons, okay, it depends on what the incline of the slope is, what the velocity that you're coming down with. It causes severe stress on the ACL ligament. That means it's one of the main ligaments inside the knee joint. And if the knee is twisted, which we call as a pivoting injury, so ACL can only stretch for a certain period of time and it gets cut or ruptured. That's what that ligament injury report says. Now, how do you treat this? Because I think the advice that he is being given is that he goes through some form of rehabilitation and then afterwards they'll reassess him and then advise him whether to go for surgery or some other form of treatment. It's a conventional practice for anybody having ACL injury to go through a period of rehabilitation, which we call most cases as rehabilitation. Because whenever you have an injury to the ACL, there are many varieties of injuries to the ACL. Typically what happens is most patients during skiing itself, when they have a fall or they twist the leg or the ankle, they feel like a pop sound. And then suddenly the knee becomes swollen, they lose their balance, they tend to have a fall. Whenever that swelling is there, that means there is blood inside the knee joint. There is a lot of active injury response that happens. And that spans for a few days to a few weeks in different stages. All of this has to be taken into account when we decide the treatment or what type of treatment. The next thing comes is what we call as the patient factors. That means, what does he do? वो काम क्या करता है? Is he an elite athlete? Is he playing for the Indian rugby team or the football team or the cricket team? Or is he somebody who is in his mid-40s? He has house upstairs, his shop is downstairs, he goes in the lift, comes up and down, he doesn't play any active sport. So what I'm trying to say to you is whenever we decide and recommend a treatment plan for the patient, it's usually customized to the patient's requirements. ACL ligament is very important to keep knee stability. That means to stop it from wobbling. It's an important structure. It contributes to the mechanical stability. If we have to advise somebody, we have to look at the patient, we have to look at what they do, and then recommend the treatment. There may be some conditions which will advise more towards surgery. If the patient is not willing for surgery, it's not a limb-threatening injury. I'll repeat it, sir. ACL injury is a significant injury, but in most cases, if there are no other structures that are involved, it's not a limb-threatening injury. Okay? So they can go through rehabilitation, take their time, and then decide whether they want to go through surgery or not. Again, surgery is a very commonly performed surgery. There's a lot of surgeons who do ACL surgery. There are multiple graft options that we've got in terms of whether we take hamstring graft, patella tendon graft, all those kind of things can be discussed. But this is not an injury which requires an emergency operation. If that is your question, whether he can wait for 2 months and then take a decision, it's absolutely fine. I don't think there is any urgent requirement. If the rest of his parameters are fine, not to worry about it. So he can go through rehabilitation, allow the things to settle down, think about it, look at his options. And then if he feels like surgery is what is the best option for him, then yeah, he can go ahead and have surgery. Fantastic question. Okay, because as I was saying earlier, injury prevention and falls prevention is a very important concept, and sometimes it's useful to have open discussion. Predominantly, the kind of neurological things that you mentioned, which can be stroke or cardiovascular things like what we call as a myocardial infarction or a heart attack. They have certain risk factors. Now, if you are an individual who already has those risk factors, so let's say you always run a very high blood pressure and you've been taking medications but it's up and down. So please don't ignore that, thinking that, oh, I'll just keep taking this one pill and it will reduce my blood pressure. It won't. If it hasn't, then there might be some associated factors that need to be looked carefully. Okay? So the first point is identification of all the risk factors which will contribute to this and correct management of these. The second thing is most of the times you tend to get certain red headaches or certain prodromal signs. That means black spots in front of your eyes, occasional loss of balance. Okay? Sometimes you start getting some tingling sensation in around the ears or some buzzing sensation around the ears, or you start to feel some arm is gone weak. All these things which are like telltale signs of something major to happen. It's better that you stay within your cautious limit. Now it depends on where you are and what circumstances you are, but minimizing those risk factors and keeping yourself within the safe limit. What is safe for you? This gentleman may have a slightly different safety limit or a safety envelope compared to you. His balance might be better, so he can go and walk outside in the park without a stick. Whereas if you feel you're a bit wobbly, getting onto that step, if you feel having a stick next to you gives you that confidence, and so be it. You should have that stick. Okay? So the other things is adjuncts, building that safety envelope around you. So identifying all the risk factors associated with heart and your brain, especially circulation, like high blood pressure, atherosclerosis, if you've got diabetes, because diabetes again is a package thing. It never comes on its own. It affects everything and anything in your body. So if you got those things, then it's better to manage those things. Seek professional opinion and keep things under control and be aware of those situations. And if you can do that and minimize the risk factors, keep them under control and know what your safety limits around you are. Third thing comes is adjusting the environment around you. A lot of people take their own mobility for granted. If at all your balance is poor and if you think that having a safety rail in your home is good, or be it in your bathroom, you want to sit down and then stand up, you need something to hold on to which is a bit more secure, then you need to get them fitted in time. So what I'm saying is you need to build that safety environment around you based on what your individual circumstances are. Only then you will be able to perceive when these things don't fall into place. If you wake up in the morning and you have a throbbing headache and you never had that in your life and you still think that you can carry on with your daily activities, then that's asking for trouble. Whereas if you go try and seek medication, gets professional opinion, maybe if you're hemorrhaging inside the brain, then that can be spotted. And most of it revolves around what we call as a concept of don't leave it time. If you have a CT scan of your head and it shows that you've got something going on inside your brain, whether it's an infarct, that means there's a blockage to the blood vessel, or a hemorrhage, that means it's bleeding. Depending on that, the outcome is decided. I can't give one medicine for the other. But if I spot it at the right time and I give that right medicine to you at the right time, the outcomes are entirely different. That means you won't have secondary, all those associated neurological problems like stroke associated problems. You're not developed. It's a timely identification. So I think if all of these things are done, then you can at least prevent them from becoming really bad. See, nobody can predict the future. If you've got those risk factors, they are bound to happen one time or the other. But if you minimize the risk factors, then you're increasing the safety amount. I hope I've answered that question. Yeah, it's a very valid question, but equally it has a very in-depth answer, which I think is not appropriate for me to give at this point of time. But in summary, basically anything to do with kidney, we are 80% water. Okay, so if your water intake or your hydration levels are not appropriate, then kidneys have a direct impact on that. High blood pressure has a direct impact on the kidneys. Okay? The medications that we take, sometimes people give some supplements. You take them as a supplement, thinking that it's going to be good for you. But you don't know what's gone into that supplement. So do your own due diligence before you pop anything. So that feeds into this lifestyle question in terms of whether you rely on something which is sourced naturally or whether you want to go for something which is processed and given to you in a concentrated form. A lot of things, there is no clear-cut black and white, wrong or right answer. A right balance of risk factors and anything in your lifestyle which will address those risk factors is what is important. So if you're somebody, I'll give you a simple example. Osteoporosis or weak bones is a common condition, right? But equally, you can stop that bone mineral density from getting worse. Because if it gets worse, even simple slips and trips tend to have what we call as fragility factors. So how do you minimize that? By keeping yourself active. Not running a marathon, but having a daily schedule for exercises within your own limits. It can be just walking in your own living room. Right? Most of us in COVID time we did that. Walking in the living room. But it still keeps your muscular system going. It keeps your body system going. So a simple answer to your question would be identify the risk factors that you as an individual have and prepare something in terms of a lifestyle which kind of minimizes those risk factors. I think that would be applicable to all conditions. Whether to take a calcium tablet, whether to take a vitamin tablet, it's very specific. If you don't have any vitamin deficiency, is it worth for you to take artificial vitamins? Not really, right? So you're getting it naturally from natural sources. You don't require it. But yes, if you are somebody who's prone and you have some sort of malabsorption, you can't keep up all the vitamin levels despite taking adequate in your diet, then you probably need support. So find out the risk factors that you have, build a lifestyle around that to minimize those risk factors. See, knee arthritis, as you said, is a very common problem, and bulk of that management revolves around managing your pain, because pain is the one which is stopping you from going about with your daily life, and that tends to affect the quality of life as well. When you look at the treatment options, broadly speaking, there are certain non-operative treatment options, but they don't work in isolation. If you just keep taking a painkiller or keep applying a balm and think that it's going to take care of it, it won't. Maybe it will do for a short span of time, but then it kind of fizzles out. Then you go into more advanced methods of managing that pain, including certain neuromodulation, surface therapies. Physical therapy is part of that. Then you have certain intra-articular injections, which we tend to do. The procedure that you're referring to is what we call as nerve ablation. Typically, that's around the genicular nerves. There is a network of nerves which supplies that sensation, and it helps you perceive pain, and it gets related to your brain. Now, if you block that sensation, right, that means nothing else around the knee has changed. That means the mechanics of the knee hasn't changed. You just alter the biology. Okay? It's a very populist procedure, and outcomes of this has been already studied quite extensively. Again, it requires an expert team to be doing it because there are certain safety aspects that has to be looked into it. If they are offered to you, then in terms of the larger risk, it's a fairly safe procedure to have. Again, it depends on where you have it and how long the relief is going to be. Most studies would say that it's kind of a medium-term solution. That means it tends to give a result which will last a few months, a few years. Not necessarily permanent, because some nerves depend on whether they rewire themselves back or not. And that goes back to the technique that the expert is using to do the ablation procedure. They have radio frequency, which is most commonly used to ablate the nerves. But this all falls in broadly as a non-operative treatment. That means you're not having a knee replacement. You're having something else to manage the pain. And you'll have physical therapy to keep yourself and the joint. Absolutely. Well, I got you. Again, there isn't a straight black and white answer. So let's say if you have a significant heart problem and the anesthetist tells you, if I give you anesthesia, the risk of you dying on table is very high, and you're still suffering from the surgery. Okay, so what I'm trying to convey to you is it depends on the individual circumstances. Some people have what I would call as a fear of surgery. Okay, some of it is valid, some of it is not necessarily valid. And some people are averse to surgery, they just don't want surgery. They tell doctor, ಏನಾದರೂ ಮಾಡಿ surgery ಮಾತ್ರ ಹೇಳ್ಬೇಡಿ. Okay, so in those kind of situations, we as professionals tend to give them all the options that are available in the current medicine environment. And it depends on the patient's choice. Because if you know the risk, if you've got all the information available to you, I trust your decision. I'm there to guide you for that process. But at the end of the day, it's your need, it's your pain. And again, pain is very subjective. So what may be painful for this gentleman may not be painful for you. Okay, so that's why on an individual circumstances and customized treatment plan, if that is offered to you, and if you feel it's a fairly safe procedure to have it done, I would recommend that you can have it done. Again, if it doesn't work, you have a fallback option. I hope I've answered. To some extent, they do get regenerated, but there isn't like a clear mathematical formula to say, if I ablate this much percentage of the nerve, then it's going to regrow itself back for this period of time. But in theory, most nerves, if they are ablated, tend to regenerate, but to a minimal extent. And what impact that is going to have, we still don't have long-term evidence, because these are all fairly newer generation techniques. Most of these have been kind of I would say perfected within the last kind of 5-10 years, and that's where the evidence is slowly building up.
Thank you so much, sir. Thank you for patiently answering all the questions. Now, Dr. Karthik, therapy head of Sukino, will give you the overview of what we do at Sukino.
Having heard about the doctor, so what is he saying, I just want to give about an overview. What do we generally do at Sukino? Who are we and what are we intent to do? Sukino is basically a continuum care center. What do you mean by the term called as continuum care center? You have a primary hospital. What your primary doctor prescribes, the same kind of treatment is also followed in other places also. We are an inpatient rehabilitation facility. Patients come over here, they stay here for some time. Once they are good to go, then they get discharged, then they leave. Sukino does a kind of a 360-degree approach. What is 360-degree approach over here? We do recuperation. What is recuperation? Bringing back the patient from illness. We handle patients directly from ICU. Okay, step-down ICUs. Okay, so those kind of patients also we handle them. Most of the patients of the neurological disorders like stroke, spinal cord injuries, Parkinson's, road traffic accidents, those are the prime patients. We also handle oncology patients, orthopedics, cardiology, all those patients of any variety we handle it. And second thing comes after recuperation is rehabilitation phase. We have a full-fledged department of therapy comprising of physiotherapy, occupational therapy, respiratory therapy, speech and swallow therapy, and clinical psychologists. So everybody are efficient in their own fields. We have a 24/7 DocToc here. We have a 24/7 nursing. All of the nurses are ICU trained nurses, and as I said, a full-fledged department of therapy comprising of PT, OT, RT, ST, clinical psychology. We also give a 24/7 dedicated caretaker to all our patients. Okay. So he takes care of all the personal hygiene and things like that. So apart from that, I have also got here a full-fledged therapy team from all our centers. We have 5 centers, 4 in Bangalore and 1 in Kochi. In Bangalore, we have a HSR, Bognahalli, we have a Whitefield, this is one center, and 1 at Koramangala. Now may I present the team here? May I have the HSR team? Can you please rise up? Team HSR. Thank you. Team Koramangala, wherever you are, you can please stand up. Team Koramangala. Here you see all physiotherapists, occupational therapists, respiratory therapists, and speech and swallow therapists, and a clinical psychologist also. And team Bogdahalli. Last but not least, team Whitefield. Thank you all for coming. And at last, I would like to say a point. I have a video to show all our centers. What you see, this is a therapy area. These are all the therapy equipments. Whatever you see over here, all therapy equipments. So this is a virtual reality training. The patient stands over there, majorly for the dynamic balance support. Like this, we have all the equipments over here. All our centers have the same kind of a facility. We all work 24/7. What you're going to see over here is about the whitefield facility. The reception. Cafeteria. The place where your recovery starts, the Department of Rehabilitation. All our rooms are private rooms, individualized rooms, ensure that the patient privacy is there. Hospital address. That's the end of the video. Thank you all. Thank you for listening. Now I'm going to take.
When you look at what are we trying to achieve for our patients with rehabilitation, okay? The end objectives of the outcomes are, and what we've been discussing so far in this session, to improve the overall physical function, reduce the pain, prevent them from having further injury, and that can take many shapes and forms, by providing them conditioning, that support, that proper assessment, but also doing some counseling and patient education, because I believe every one of us has a certain counseling element built into it, right? So that's important. And you speed the process up. So you improve these milestones. And lastly, and most importantly, you improve the quality of life. So these are all the objectives. Does anybody in this call disagree with them? No, right? So it's all like very commonly agreed kind of thing. But then we've had challenges, and very big challenges. And I'm sure every one of us has faced some of these challenges, including when last class, which none of us wanted, but we still ended up getting. Okay? But that has a direct knock-on effect on how our patients were able to access our care. Because we were ready, the place was ready, but we just couldn't treat the patients. Okay? And that has an implication for cost, because everything revolves around cost, whether we like it or not. And the next thing is, once that pandemic kind of started and easing off, how do you integrate everything back into the overall healthcare services? Because when Dr. Karthik or someone talks about continuum of care, it's a continuum. That means it's like a spectrum. When you look at a rainbow, it's not one color in isolation. You have to look at all the colors. That's what makes it pretty. So in all of this process, how do you build in evidence-based practices? Because this is the generation of evidence-based practices, right? So if and when you have certain thing, a certain equipment which can give better results, and there's enough evidence around it, then you can convince somebody that there will be better ROI, okay, return on your investment, correct? By not making financial sense. And then how do you measure those outcomes? Because then you can consistently demonstrate that what you're doing is the best in class, right? So these are all the challenges. Am I audible now? Yep. Okay, good. So, as Indians, I think generally you'd all agree that we are very good at jugaad, right? We try and come up sort of any solution that we want. So any challenge that is presented to us, we all have that innate ability of problem solving that means to come up with some solutions. So, and this has taken off in a big way, which is tele-rehabilitation and more recently virtual rehabilitation as well. So this is that same graphic designer that I was mentioning in the earlier part, and he tried one of these, which is an entirely virtual reality based rehabilitation kind of exercises. These are very low key, but they get the patients getting started. It's like taking your baby steps, giving them that confidence that after being strapped up in a plaster for like maybe 2.5, 3 weeks, they can still exercise those fingers, start moving those wrist joints, getting that mobility back. I'm sure you've all experienced such patients where, it affects their confidence whenever they have a procedure, be it whether it's a traumatic injury or they've had a procedure like a hip or a knee replacement. And that's where getting them started is important. You can run the table. So this is all self-taught, by the way, okay? None of us guided him on this. So you can see that he's got 3 different sizes of walls in front of him, okay? And it gets harder and harder. So this is the smallest block, and he has to place it at the topmost shelf there. And you can see his movements there. So this is what most gamers would call as an immersive environment, because you're completely immersed into that environment there. And so the next thing we designed as a task for him was to grab hold of these bricks, and there's only one surface of that brick that engages onto that wall there. He has to exactly match that slot so that this thing fits in. And you can look at the combination of movements in his hand, wrist, and forearm and shoulder. So he has to do that complex movements to achieve that end outcome. So you get easy, medium, and hard, and that's where he is now. And this guy is just 2 weeks, by the way, from his surgery, right? So he is able to do this. So this one is again grab and release kind of thing. Okay? So it goes further and further away. So that means he has to stretch his shoulder, his elbows. That's it. Okay? So this entire thing is completed within probably 2.5 minutes. But there is a backside story to this. Before he did this, I gave him a challenge. I said, once you come to see me, I want you to type at least 1,000 letters within 15 minutes. So I gave him ample time. Okay? And lo and behold, he did this, and within like 8 or 9 minutes, he was able to type those 1,000 words. Albeit with difficulty, because it wasn't that normal keystroke that you have on a laptop, but he did manage to achieve that. And the amount of confidence that he gained after doing just this, he kept repeating, because it's kind of a very immersive environment, right? And after a while, you fly solo. If somebody taught you flying, you start flying on your own, right? So it's the same kind of experience. Okay, next one. The next one is all about remote monitoring. And wearable technologies. There's many of them, and trust me, I'm not an expert on those, but I'm here to share some of my modest experience that I've had in terms of these as well. So I'm one of the technology developers for this app called as Postdoc, and it's a combined effort of 3 orthopedic surgeons. Okay, 2 of them are very close friends of mine. They're based out of London. And we've got the technical team coming in from Milan and Italy, and that's why you see all these kind of fancy logos. If you had given us, we would have made a very scribble kind of a logo, but they are more aesthetic, right? So they do all these kind of logos here on that. And it helps patients to get regular prompts as a part of their rehab protocol. Yeah? So you can create customized plans. But more importantly, when they are struggling to get access to a healthcare provider, or let's say there is somebody going there into the community. So I'm sure Sukino provides a lot of home nursing, right? But how do they then communicate that? Now you'd say I'd send it over WhatsApp, but that's not the industry norm because of patient confidentiality. A lot of countries would ban you from sending images. So in the UK, what happens is there's something called as GDPR. You have to be compliant with those data protection. So this app has built in this function where the patient's images can be taken when they're going through the rehab, but at the back end of this app, it's got artificial intelligence built into it. So what it does is it's able to pick up if somebody has got early cellulitis. Because, you know, when you see somebody's wound, you'll go, oh, that doesn't look normal. But how do you then tell? How do you escalate that? Because that's what you're trying, your brain is prompting you, right? To say, maybe this wound doesn't look good. Maybe that swelling is a bit more. Should I get it checked with some medical professional? How do you keep that continuum of contact, that to and fro communication? So this has that facility built into it, okay? And the patients or the carers can directly communicate with the clinical team, okay? So if you can come back, next slide. And you can build whatever treatment plans you have, okay, for that particular patient. And you can stay connected to the patient, the caregivers, even when they leave the center and go in the wider community. But the bit that I like about as a surgeon is, for me, just at the click of a button on my laptop, I get this beautiful dashboard. I can see which patient of mine has done their homework and who needs a wrap on the map. Okay? So I'm able to call and tell them, exercise madi live. And he goes, sir, you know, it's that kind of constant engagement. Plus, it gives a lot of details about the patient in terms of their metrics and other things, which a lot of clinical systems do. This is not, it's just an industry standard. And this serial monitoring of wounds, which again, as I mentioned, is useful. Okay. But as a snapshot, you can look at what interventions you did. You know, the effect that's had on the patient's quality of life indexes, their pain scores, the numeric rating scales. You know, you can objectively show this to the patient and encourage them to do more. So let's say somebody comes to you in your center, they do a session for a week, and then they go back home, and then they do some exercises, and you keep motivating them and say, continue doing it, come back the week after. So when they come back, you can show that that difference what it's had, those 2 weeks of critical therapy and rehabilitation. Okay. And this is now, again, as an industry norm, I think Dr. Karthik would agree with that. You would never work in isolation. Okay, you always work as a part of team, and I think I'm glad to be here because it's one of the few places which has taken a forefront in this interdisciplinary approach of managing complex problems, and that has a direct impact on the patient outcomes as well. And exercise-based rehabilitation. If you were to say to patients that this is a part of your lifestyle, and as you can see, a lot of the questions that are evolving is lifestyle related because lifestyle is something which is a choice. As youngsters, you can decide whether to have a fag or a booze, right? But when you get older, it's about whether you want to get out of bed and do some exercises. Okay? So if you make it as a part of their daily routine, then the acceptance is there. So that, again, I don't want to dwell into a lot of studies. Dr. Karthik is there to give you some more details on that. But there is enough evidence now to suggest that if you make it as a part of their daily routine and say that this exercise is going to improve a lot of outcomes for your metabolic problems, your musculoskeletal problems, your neurological problems, then it works well. And finally, this is, the God said number, evidence-based practice. What is it? A lot of talk is given about evidence-based as a recent trend, but essentially you look at what experience you as a center have, you look at what is available in terms of the practices that are there, you match the patient's values. You see what the patient's expectation is, right? It's just like us going to a restaurant and saying, get me masala dosa. If that guy gets you idli vada, will you have it? No, no. It's food. He's giving you hot served food. But you not have it. That's where patient values come in, that patient choice comes in. So how do you integrate all of this into that evidence-based practice? So in summary, I've kept this very short because I thought I'll give you a snippet of what I feel are some of the trends that are happening, and this is based on just my personal experience. There's a lot more things to delve into, but in summary, I think a lot of remote connectivity with the patients, the caregivers is very important. Wearable technologies, because there's a lot of industry push from many big players. But what is under our control as our team is these three things, the interdisciplinary approach, building up that evidence base. Like if you suggest some therapy to the patients, you should be able to quote some figures and say, in our center we've looked at 100 knee replacement patients. When we've done this, they've achieved that milestone of being able to walk independently, going up and down the steps in 10 weeks, 8 weeks, 6 weeks, whatever that number is. So that is evidence-based practice. And eventually that will lead to patient outcomes. And once the patients are getting the best outcomes, obviously they are the best brand ambassadors. At least that's what I believe for any company or brand. So I think I've kept it very brief because as I said to Dr. Karthik and someone is, I wanted this to be a more interactive session. So if you have any questions, queries or not, please feel free to ask.
App which you are maintaining about, you are saying about the remote monitoring app. At what stage do you recommend you go for a use with your patients? Because personally, what I feel like when I am rehabilitating a patient, I feel like I need to supervise that patient whether he is doing his exercises properly or not. If at all I give him that app, he may do the exercise, he may tick, okay, I have done it, but I can't see him whether he is doing it properly or not. For example, if I give him an example for exercise for strengthening his shoulder retractors, and he is doing shoulder extension, the movement can be the same, but it depends on a lot of our muscle contractions. So how do you make sure that that he is doing the right thing? I personally prefer the same app to be used as a home care exercise later on. So once his rehab is completed, okay, then we continue these exercises. At that point of time, he might have already learned the exercises. Then I just have to make sure that he is continuing it. So what is your point?
Your name?
Nitin. So I'm myself Nitin Krishna. So I'm the therapy in charge for Koromagal Center.
Okay, Nitin. I think you partly answered the question yourself. Okay, it depends on when you put these technologies into that patient's continuum of care. Okay, a lot of this depends on how you time it. Okay, if you've already educated that patient about those exercises, but then let's say they are an elderly couple. Okay, the person is motivated to do the exercises, but they need those prompts. Okay, so if you say to them that I have created a customized treatment plan for you, we've done this for you, but when you go home, sir, look at your phone, whatever it's telling you, keep doing them, keep sending me the feedback, I encourage you to do more. So it's a continuum of care. That means when they go out from the center, when your team is reaching out there, that's where this app comes in. Plus, it's kind of another communication with you. So going back to your point, when you put that in to that patient's pathway, depends on each patient's treatment plan. Okay? When you require that initial hand-holding, supervision, yes, it has to be on a direct patient to professional contact. But once they're out and you want to know that they're still following the trajectory that you told them, right? That's where this comes in. Thank you.
Good evening, Doc. So I'm Mohammed Zakaria, therapy lead momentally. So if you see some of the neurological injury patients, so traumatic brain injury patients and as well as stroke and as well as CP patients, so they will be having an impairment called spasticity. So those patients who have seen some of the surgeons doing kind of an tendon transfers and muscle lengthening. So how it will help on clinical progresses and what you take a call on that one? So
it's a very complex topic, especially when you have these chronic neuromuscular conditions, and it depends on what's the age of the patient that's in front of you, what is the sort of social background that they're in, because if it's a child, as you said, a CP child, right, they have complex deformities, they have complex contractures. Now, how do you make the nursing requirement of that child, because the mother and the family will be the ones who will be the caregivers for those patients. How do you facilitate that? If somebody is like this and they can't even change the nappy for that person, it's extremely difficult. So if you can do certain muscle releases, if you can do some bottom contraction, and you can make that a much more manageable situation, then that will be the end objective of all the treatments that we do. So whether it's going to be predominantly surgical management, combination of surgery, injections and those kind of things, or all of them put together, depends on individual patient's presentation, what is the underlying problems. There was one patient which I saw where the fingers were digging into the palm. Okay, so in those patients we have to do a flexitinotomy just to get the finger extension out, but also to protect the skin of the palm. Okay, now that's why an individual assessment is very critical. Listening to the caregivers, sometimes listening to the patients as well, because they will tell you what's bothering them. Okay, that's what helps us design a customized treatment plan.
And some patients will be having less neuromuscular control over the joint, and as well as no neuromuscular control also. So some of the surgeons I have seen they are doing kind of an ACL reconstruction surgeries also. So so how it will help in prognosis, like how you take a call on that particular aspect?
Yeah, see again, the call whether to intervene and at what time point do you intervene? Because most experienced surgeons would tell you that they will have certain amount of insight into the patient's condition, but also certain foresight. That means if I operate on that patient now, okay, it might mean or it might look like an extreme step. But if I'm going to stop much more bigger problems further down the line, like cutting somebody's tendons, to get that, looks like an extreme step. But if you hadn't done that, that fingers would have dug into his skin, chronic ulceration, infection, cellulitis, hospital admissions, sepsis, multi-organ failure. Okay, so what I'm saying to you is whenever the intervention is carried out, it depends on that professional who's achieving the objective, and that's based on the insight and also the foresight that they have.
Thank you, Doctor.
All done? Bored, everybody wants to go home Friday evening or Saturday evening. So the functionality of the app is based on an open architecture. As you can see, I have put a few of the other professionals that I work in as a part of my team. So it works on that network. So let's say you as the admin have like a core team of 5 or 10 people involved in one particular patient, and you want to give them instructions. So you can build that network around that. So it's very kind of customizable. And again, this is meant for a particular situation, but easily you can build your team around it. Okay, what function that person does. So let's say you want somebody to measure the prompts of that patient. Okay, you want somebody to monitor the joint swelling, do certain range of motion exercises. Those can be customized, and you can give them a customized treatment plan, and they can update you on a regular basis, because from that dashboard you can see whether the patient is achieving those milestones or not. So, or let's say you have a nursing team going and doing the daily antibiotics and the wound dressing, okay? And let's say you want that patient to be monitored a bit more closely, because you looked at the wound and you felt maybe it's a little bit red, but then you speak to the surgeon says, okay, keep a close eye on it. So you can keep that as one button which says monitor it more closely. So the app will alert you if it spots that there is something which is not going in the right direction. So it can be used as an early warning trigger as well.
Thank you, sir.
Now I call upon Dr. Karthik for vote of thanks.
Thank you. So I thank our CEO, Mr. Rajashwin, Mr. Shalini, the Director of Human Resources, and I thank wholeheartedly Dr. Darshan for patiently answering all our questions, and especially before the session was extremely awesome, Doc. Thank you so much for your patience. Means a lot for us and your valuable time with us. I also thank all the therapists who have come from all our law from different centers, Isaac and team for helping organizing this event, team branding and communications, team sales and business development, and each and everyone who has made this evening a spectacular show event. Thank you all once again.
Now we